myself. I'm Dr. Livia Shrieky, and I started hosting these webinars to help clinicians navigate complex issues in evidence-based treatments. So I'm excited to be here with my colleague and friend, Dr. Megan Creedon, today to talk to you about parent guidance in DBT. So as a reminder, just a couple things before we jump in. One is this is a fundraiser webinar. So any proceeds are going to the Family Connections program of the BPD Alliance or any BPD. I just put a link in the chat. We have raised a little over $200. It'd be awesome to raise more. If you can donate $1, $5, whatever you can, would be appreciated and really nice. It's kind of our effort to affect some change in the world right now and contribute to our community. And then the other main thing that I just want to mention is if you're here to earn continuing education credits, please make sure to stay here the entire talk. And we will be sending out some questionnaires for you to complete after the talk as well to receive your certificate. All right, so I will let Megan introduce herself and then we can get started.
Hi, everyone. It's nice to see so many faces and just to have this opportunity to connect with you all across the country and maybe in other places too. I am a psychologist and I practice DBT, and I do a lot of parent management and couples work in my practice in addition to individual DBT. And Livia and I in the past have run a parenting workshop for parents together too. So we've had this great opportunity to work together around parent work and bringing together different parenting approaches, which you'll hear us talk about today. I am based out of the Boston area and co-own a practice, the Mindfulness and Change Group, where we offer evidence-based treatment for children through adults. And yeah, that's me.
Yeah. And I own a practice called Collaboration Practices and do a lot of parenting work of parents of kids in DBT, both teens and young adults. All right, so I will share a presentation on one sec. Right. All right, so we're going to start out with an experiential exercise. Megan, I'll let you go.
Yes, so we're wanted to just start out first as we're talking about parenting today, and wanted to give you guys a chance through either scanning the barcode or clicking or copying and pasting the link, typing in the link. There, it's sort of a virtual whiteboard where you could just write out, type in any kind of interventions you already use, approaches you draw from, strategies you like. And Olivia has it here. The link is now here. You'll start to see as you guys type in, they'll populate here. It's just a way for us to put our heads together and see what folks are already doing. Yeah, definitely space. We'll talk about that some today. Giving advice, building rapport. Absolutely validation, PMT. Got some behaviorism, acceptance.
More validation. Relationship building.
Yeah. Psychoed. The transactional model. Yep. Yeah, reactivating that relationship, rebuilding, putting money in that piggy bank.
DBT skills as well.
co-regulation. Yep. Sharing resources. Perspective taking. Good stuff.
Mm-hmm.
Yeah, so these are many of these we're gonna talk about today and kind of talk about how we pull them in to the specific parenting adaptation that we're proposing here today.
And you can see that, many of you are already using a lot of strategies and know a lot of different approaches, right? And these are probably a lot of the approaches you're drawing on. We're not going to go through each one, but there's been a lot of research and practice in parenting interventions, and recently a bit more development in the DBT area. And our goal today, hang on one sec, there seems to be something wrong.
Yeah. One, there you go.
Yeah, I don't know why that blue thing is there, but it's not. It's like from the other slide. Anyway, so we're gonna accept that, use our acceptance skills. So our goal today is not necessarily to teach you new skills, because clearly you all have a lot of skills you're already using, right? And the strategy today is more to help you kind of have a model in your mind that can help organize some of these parenting interventions, and kind of provide a roadmap, a conceptual map to help you kind of figure out how to strategize and how to what to use when and how to think of it. I just got a question about sharing the slides. I'm happy to share them after the presentation. Okay. All right, so we're going to jump into a case example. And this is a case, Megan, that you've worked with to kind of demonstrate.
Yes. Yep. So we have some clips of a role play that Livia and I did to show you that you'll see throughout the rest of the talk. But just to introduce this case, this client or the child, and just as a orienting piece, we're going to use the word kid in this talk, but that really this intervention can be used for young kids. It can be used for teens, young adults, just kind of like any child or kid. So we'll kind of use some of those terms interchangeably, but that's what we mean. We mean like the child or the adult child in the situation when we're talking here. And again, it's not meant to be limiting based on age. What we're talking about here today, these strategies can be used with children from a range of ages. So in this case, the case that we're role playing today centers around Jessie, who's an 18-year-old trans female who identifies as bisexual. She uses she, her pronouns. She's been diagnosed with borderline, major depression, ADHD, and has some problematic marijuana use. She limped through, but ultimately graduated from high school and was able to do so probably in large part by having attended a private alternative high school where they gave one-to-one instruction. And it allowed for, she has a lot of school avoidance, and when she wouldn't show up, it was an option to just keep adding on those classes again. So they were able to get her through high school that way, but at a pretty large financial cost because she missed a lot of school. So they ended up having to pay twice, three times, four times for the same course credit because of how often she was missing school. She's an only child and now is 19 and working intermittently part-time. She's worked as a nanny or an after-school care, and had an interest in, which mom had been encouraging, to try cosmetology school. She really likes like hair and makeup, so mom thought this would be a good way for her to get some experience being back in a school setting and hopefully pick up a skill that she could use and fall back on throughout her lifetime as a way to make money and support herself. So she recently started cosmetology school, and has again been struggling with attending. She struggles when she's not doing so well with getting activated, with doing opposite action, basically. She also tends to spend and has trouble with takeout, ordering a lot of takeout food, or just spending. Like, she'll kind of get on these kicks where she's collecting Legos and then reselling them, or collecting. Another one recently has been like buying and selling medals from eBay and Facebook Marketplace, and then trying to take them to pawn shops to sell. So kind of like a hobby, but also like a way that she ends up spending a lot of money, which sometimes she recoups part of as these sort of like small business schemey kind of ways, but sometimes not. Like, sometimes it just piles up in their living room. She's still struggling with substance use and absolutely developing greater independence. She has a history of self-harm, suicidal ideation and attempts, and was hospitalized more than 2 years ago for a suicide attempt. And at the time of that hospitalization, she says that she was sexually assaulted there. So it's made the parents really reluctant to hospitalize her again, even at times when she's described greater suicidality or demonstrated that she's had a hard time functioning outside of the home. The parents are Tara and John. They are married. They have a really strong relationship with each other. A really, I think, positive marriage overall. They're both educated and they work full-time, largely remotely, which makes them accessible to Jessie and able to kind of jump in and help out when she has trouble getting up in the morning and that sort of thing. The parents struggle with holding limits. They alternate between them and within each other, between being overly critical or overly permissive with Jessie. They worry that they can't expect more from her because of her ADHD and depression. So there's kind of like a lot of fragilizing that goes on, of like, well, how can I expect her to clean up? She has ADHD. Like, of course the living room's a mess. It's not her fault. She's just really struggles with organizational skills. They believe that limit setting, often when it's been suggested, is unfair. And they, like a lot of parents, they struggle with, well, she's 19 years old. How could I possibly take away her phone or the internet or access to the car that we bought her? They're really her things. And, they struggle with feeling like, is that an okay thing to do? Or would it be cruel, considering that she's really struggling with feeling depressed? They have a history, like I mentioned before, of paying a lot financially for outpatient therapy interventions, but also for missed things like school, cosmetology school or high school. They have expressed a lot of frustration and burnout, and feeling really isolated from their peers. When Jessie was younger, they felt like pretty connected and had a lot of friends, parent friends in the community. And as Jessie transitioned and then began having more and more mental health issues, they felt really like kind of the odd ones out, and that many of their peers couldn't relate to what they were going through. And I think there was just some shame that led to them kind of pulling back from their social lives. And Dad in particular expresses a lot of sadness, that their family is not the way that he hoped it'd be, that this is not the kid that he felt really well matched to parent, and has kind of struggled with that, as has Mom to a certain extent. So that's the case that we'll be sharing with you today.
Yeah, and so we're going to start with a video, and we're going to be sharing kind of snippets of kind of like a role play of a session early on in treatment, where the clinician is still getting to know the parent and working on starting to conceptualize the case. So we're going to show kind of the intro where the mom describes what's going on with her child. And we'd like you to kind of use this as a bit of a mindfulness to notice what are the thoughts, internal kind of reactions, experiences that you're having, and what are the interventions that are kind of going through your mind as you listen to this mom talk.
Hey, Sarah. Hi. So why don't you catch me up on what's going on? Well, okay, so a lot of things have happened. What should I start with? Let's see. So Jessie has, as you know, you already know, like that Jessie lost her job. So she's not working. And right after the car accident happened, she obviously stopped working. And now, she was taking that 2 week break from cosmetology school. And this week she said she wants me to drop out. Actually, I can redo the whole thing that she texted me, that she wants me to write to the director of the cosmetology school to withdraw for her from the school. So she says she's really depressed and she's like not doing good at all.
And this has happened often, that she started something and then stopped.
Yeah, I mean it's just like school all over again. I mean, she didn't go for a full week to cosmetology school, and she never did that in high school either. And it's so sad because I know that she's like, I think on some level she sees this pattern too, and like is like doesn't think she's gonna be able to do anything. Maybe she's saying now I never wanted to do cosmetology school, but I know that's not true. She loved it when she was there. But she's like, well, I don't want that to be my career anyway. But I know that, but she like it was a step forward. It's something for her to work toward and like build some momentum, and then something she could always fall back on, that she could at least make some money doing.
When she was planning on it, did it sound like a sound plan?
Well,
was she kind of like anticipating what might go wrong and not overreaching?
no, she won't take any advice. She's just like, oh yeah, it'll be fine. I kept saying to her, like, talk to your therapist about this, like, and but like I scheduled the tours for the schools, and like we did the application with her, and like we offered to wake her up to get. We woke her up all the time to help her get there. We said we drive her, like we did everything we could, and like I just feel so guilty because like my kid is suffering, and I feel like on the one hand I've done a lot, and on the other hand I feel like I'm just not doing enough to help her.
And so what is she doing to that like shows you she's struggling right now? You said she's depressed.
Well, she's just staying in bed. She's not doing anything. She's mainly just staying in bed, telling us that she's depressed, and she's like back to ordering takeout and like.
So she's doing a lot to kind of show you she's distressed and also wanting you to fix it.
Well, she's going to say she wants me to fix it, but I feel like I need to help her fix it. She can't do it herself. What is she supposed to do? She's depressed.
But she's texting you that she wants you to write to the school.
Yeah, she wrote up the whole thing. She wrote actually a pretty good email.
What do you think? Yeah. So on the one hand, she's writing really good emails, and at the same time, she's wanting you to do it.
Yeah.
Do you know what do you think is making her not be able to do it herself?
She just says that she can't, and that she thinks it would come off better coming from me.
So she's kind of anxious about what might happen.
She doesn't say that, but maybe.
Yeah. And at the same time, without the pressure of doing it herself, she's able to come up with a really good email. Very.
Yeah, I didn't ask her to do that. I don't even want her to send it because she's saying that she wants to withdraw, and I don't want her to say that she wants to withdraw. She could just say like taking some time off, and then if she's feeling better, she could go back.
So we're wondering, what are people's thoughts? What do people notice? And feel free to speak up or put it in the chat. Beryl.
Well, I think it's a pretty classic presentation. You guys did great. The mom, I mean, you completely pegged it. The mom and dad completely overfunction for this kid and get caught in their own bind of guilt with her and have trouble kind of having expectations of her that even in incremental steps that would help her. And so, I mean, I can resonate with all of the things that the mom said because I've heard them and all of the things that the therapist said.
Thank you. Thanks for sharing. Adriana?
Olivia, nice to see
Hi,
you.
you too.
I think it's missing a little bit of validation. This is a pattern I would probably give a mom the validation of like, okay, we've been here before. I wonder how you're feeling and trying to connect a little bit with the experience. I think it is spot on to address the active passivity and help parents set limits around what you're gonna do and maybe encourage the child to be the one doing this actively.
Mhm.
I do believe that there's so much grief in this case that not pointing it out or not talking about it will be a missed opportunity for acceptance for parents to be able to move into change and
Mhm.
setting boundaries.
Mhm. Thank you. Awesome. And you mentioned some of the dialectical dilemmas that we'll be talking about too. Colin.
I thought it was interesting. Like she rambled off a bunch of things that they did for her to get to get in there, get everything moving. They did it for her. They offered to wake her up in the morning. They did this, they did that. And then so how do you feel about it? And she answered like sad. I thought she was gonna be like pissed.
Mhm.
Um,
Mhm.
but just a thought.
Mhm. Awesome. Other responses. Thank you, Colin. Other responses. Mom's acting out of fear, anxiety. So mom is anxious and scared. Mom's taking responsibility for the child. Dialectical dilemmas at play. Right. The parents are kind of owning the ability to tolerate distress.
Or
Maybe
are they not?
communicating.
Maybe is that part of the
Mhm.
issue that they're having and I think that that point is correct that the parents do, in particular, the mom has a difficult time tolerating the distress of the child and has some inhibited grieving, like Adriana mentioned herself too.
Mhm. Yeah. And mom's overwhelmed and frustrated. Lots of grief. Awesome. Burnout. Yeah, mom's feeling stuck. Awesome. Right. So we're hearing like a lot of awesome like a lot of interesting reactions, a lot of awesome suggestions of what we might do. Um, Megan's going to kind of walk through some of the kind of things you might think about that some of you have mentioned already.
Yeah. So going back to the slide earlier when that Livia spoke of where we what we all as clinicians have access to in terms of previous models of parenting work, we created this slide that we think offers a good summary of what some of the themes are from these parenting interventions that already exist and that many of you may already be working from. So you guys mentioned, and it's true, acceptance is definitely a priority skill, like using a lot of validation, relationship mindfulness, curiosity, like just a big emphasis on accepting both the emotions of the person and the relationship itself, and finding a way to connect with and validate that with the child. Then the next one is psychoeducation, which many of you mentioned in the beginning too, like a lot of education around different parenting styles that exist, as well as things like the biosocial model or emotion regulation, like teaching strategies and ways of thinking about parenting and relationships, and behaviorism and that sort of thing too. Then we have parental self-regulation, which you guys mentioned in the chat. So teaching parents to be able to, there's often a lot of focus on teaching a child to identify and manage their emotions, but it can be equally as important to help the parents in a parenting intervention to notice how they're feeling and what they're doing to manage and moderate their own emotions. Behaviorism is huge. Understanding and crafting and implementing consistently a behavior plan, learning about reinforcement and how to do this effectively, modeling, shaping behavior, all those sorts of things. Then drawing a lot from space, we talk a lot about parental accommodation. So thinking about ways that fragilizing might be happening, where parents are then stepping in and doing a lot for their children or their young adult kids, and how to sort of step back from some of that. Then there's space too in these interventions to teach a lot and help parents practice with things like Dear Man and Give and Fast, actual communication skills, just to communicate more directly, more accurately how they're feeling, and also being able to orient a child to whatever new behavior plans or strategies the parents are taking. So it's not just kind of coming out of nowhere. Communication is important. The next piece is not in all models, but we see this again a lot in space, which is engaging supporters in the community. So thinking about how to widen the folks involved so that there can be more accountability and support for the family system around making changes in the relationship or the dynamic or the expectations, and having supporters and community members come in to hold the parents accountable as well as the child, both when you're like announcing a change that's going to be made, because often when there's folks outside of the system that are there, it can kind of help to keep people on their best behavior, and also again to help keep the family in line and reminding them, oh, I told so and so I was going to do this, and now I kind of have to follow through because it's more public. Tuning into parental values is another one. Like as therapists, we really have to work within what's important to the parents and the family themselves, and think through how we can use the interventions that we have to offer in a way that will match up with the goals and values of the family itself. Makes it easier for parents to hold those limits and things when they're doing it because it actually really matters to them and it actually matches their values. Helping families to identify and shift their parenting styles and be able to notice where they're being effective or where they might not be, and making use of multiple avenues of teaching, like just offering books and podcasts and videos that parents can check out to learn more about this. Many of you may follow yourselves or hear about clients who follow parenting experts on social media, and that sort of thing too. And so helping them too to think through who they're following and what advice they're getting, and help them make more informed decisions about that sort of thing.
So we've heard of a little already of where you'd start, but I think Adriana, you mentioned kind of like validating the parents, identifying some of her grief. Where else would people start with this case? Where do you think if you're sitting with this mom, where do you think
Yeah, hearing her talk about being overwhelmed and at the end of a rope, softening into the emotion. Yeah. Mm-hmm.
I'm thinking, I'm sorry, I can't figure out how to get my camera on right now, but this is Abby Schwartz. I was just thinking like the fear she has of something, of her, because her daughter is so depressed. She's afraid if she pushes too much or doesn't support, that there could be another suicidal attempt or something like that. And I think there's just a lot of fear that, she's not necessarily saying that, but that's something that I'm sensing as well.
Absolutely. I think that's such a good point. And this comes up with so many parents that many of us see, where they're not just afraid for nothing. They've probably been traumatized in some ways by the things that have occurred with their kids. So it's one thing to say like, hey, like you got to do this, you got to do that. But then often parents are like, at what cost? I rather have my kid be here than in the hospital, or here than hurting themselves. And it's scary for them and feels really hard to conceive of doing something that even in the short term might cause pain for a kid that they already see as suffering a lot.
And it's occurring to me, Megan, that a couple of things that are not listed here that maybe should have been listed are things like self-compassion for the parent, right? Which speaks to a bit more of what people are mentioning here about the grief and also the kind of addressing trauma in the parents' experiences. I don't know how to pronounce your name, Pidia. I apologize.
No, that was perfect.
Okay.
Well, I would start with validation because then the parent is willing to talk more and give me more information. And I also will focus right at the beginning on family values because I think that family culture and family values, because I think that any intervention I do would have to align with those values. Otherwise, the parents are not going to follow up on it. So those would be my two priorities.
Yeah.
Yeah.
Yeah, Lori spoke to that in the chat too, like thinking about not only values, but what are the goals of the family? What are the life worth living family goals that help orient and motivate people to do this hard work?
And Kayla, I think you're asking if Jesse's involved in treatment.
Up above?
Yeah, so that's just one thing I was curious about is Jesse involved? Are they working together? And if that's part of the treatment plan.
Jesse had not been originally willing to participate and was doing her own work individually, but more recently, actually, as the relationship between the parents and Jesse improved, she's become more willing to come to family sessions. And it's been an opportunity to do a lot of modeling and just like relations, kind of like what some of you are suggesting as how you start out with a parent case about first validating the kid and getting buy-in and building that relationship, that this can be a safe space where they can be heard, while also starting to introduce like some ideas about limits, perspective taking, potential change, or how to hold dialectics within the family of like, you might feel this way and your parents feel that way. How do we work together around these poles?
Mm-hmm. Yeah. Good to hear she's now involved. Yeah.
Yeah.
Yeah, I was saying another place to start, often is like, okay, well, it's been a long road with Jesse, right? Like, what have they tried in the past, right? And like, what was effective and what was not effective, and just kind of gathering more information about that.
Yeah. Yeah, and this family has been through a lot already, right? So, and I will also say that, we haven't really talked about this, but in addition to the material that we're presenting today, this is not in place of something like skills training for the parents. So, and especially with these parents who've been through a lot, they probably have attended a lot of groups and gained some skills and have some under their belt that might or might not have worked. Beryl?
Oh, you're
Sorry,
still
yeah,
muted.
here I am. I'm sorry. So I've kind of wondered how you as therapists in this situation envision your role. And I agree with everything that everyone is saying in the validation and all of these different wonderful ideas. In a number of cases that I've been involved in, the question is who are we as the therapist treating? And often it's the family system, even when all of the family members aren't there. But also, as this young person is technically an adult, um, you know, she has a different role and different rights and that need to be attended to. And how do you guys navigate all of that?
Yeah, so we will speak a little to that. Some of those questions, I think, we're hoping to do a more intensive training and might be more like kind of a deep dive. However, in this training, we're focusing on intervening on the parents' end, And so the hope, of course, is that they will be able to collaborate with their child at some point, at least, that the child will kind of, like Megan discussed, kind of as their relationship builds, will be able to come more into kind of active treatment and maybe family work. And at the same time, the impetus from this is that a lot of clinics are doing interventions with the parents. And we need a bit more guidance and thought on how to do that effectively, if that makes sense. But it is, like, I think in the parenting world in general, and if you know a bit about space as well, there is a bit of a question, like, who's the parent, who's the patient, the parent or the kid? And in this case, we kind of are seeing the parents as the patient, and at the same time, of course, the kid is in the picture as well as someone we're thinking of in terms of shifting behaviors.
But in this case, for example, what if the youth has her own therapist, are you advocating to or advocating to get like a release so that you can speak to her treater?
In this case, the youth sees a therapist that's also in our practice, so we are able to collaborate pretty easily on this case. But I think maybe more broadly to the point that you bring up is goal setting for the therapy itself. So identifying who's the patient in the therapy. And like Livia was saying, in this case today, we're talking more about circumstances where the parents are the primary client, and where you may or may not work with the kids. Sometimes we do, sometimes we don't. My preference is to bring kids in at times, but really in this treatment that Livia and I are describing, it's really more based on helping parents think about how to help them make change, which then would trickle down to the kid. But there's so much work that has to go in right from the beginning about educating parents about the fact that they're the ones that are going to need to make changes to make change in the family system and in their child. And so they are the unit of change, not like we're going to talk about your kid and then somehow that's going to make your kid change. And so there's a lot of work that has to go in at the beginning about getting in buy-in for that and getting really clear about what the goals are and how we can work toward them.
And it's a dialectic, which we'll come back to at the end of the talk. And I will say I don't know, I'll let Megan speak for herself. I tend in the assessment process to bring in the kid if the kid is willing, to get to know the child, understand what their perspective is. It usually really helps me with my case conceptualization. Sometimes they're not willing to do that, but if they are, then I would love to have them as part of the intake process.
Yeah.
All right, so just moving along. So, I think if we're going to summarize what we've seen so far today, right, is that we have a lot of very competent clinicians here with a lot of knowledge of how to work with parents in terms of what are different interventions we could utilize, how do we kind of thinking about, I guess, like validating the parents, engaging them in treatment. And also at the same time, a lot of the clients and families we see are really complex. There's a lot going on. It's easy to get confused. It's easy to get kind of pulled in one direction versus the other. Sometimes the parents come in, it's hard to validate them because they just want you to change stuff. They don't want the validation. Sometimes they do, right? And so what we've found is that it's helpful to have the dialectical dilemmas discussed in Marshall Linehan's book, The Core Dialectical Dilemmas in DBT, to help with case conceptualization for clinicians, first of all. So help us as clinicians really kind of get a bird's eye view of what's going on in the family and how to think of the different interactions and transactions happening in families. It can also it helps us provide a bit more psycho-ed for parents on what might be going on for their kids, what might be driving their behaviors, which in my experience has really helped parents access more compassion and understanding for their kids. And then finally, it helps us, if we have a clear case conceptualization, if we have the parents and a more bought in and understanding of what's going on, then of course it also helps guide our intervention as well. So one kind of unifying aspect in all evidence-based interventions are parenting styles. And Megan, walk us through them a little bit.
Yeah, so here we're talking a bit about parenting styles, which many of you have heard about in different ways. I know, like in the DBTA model, we talk about the common dialectical dilemmas of parenting, of too loose and too strict. Like this kind of pulls from that, of basically this dialectic between how do you balance change and acceptance. So this is kind of like a fundamentally DBT concept, but you can also see it in other models of parenting or ways of thinking about parenting styles, like authoritative versus authoritarian versus permissive parents. So we think of permissive parents as being overly and indiscriminately validating, while authoritarian parents are more on the overly rigid and problem solving side. So, and then under each of those categories, you can see just again that polarization between being, on the one hand, overly validating, and even validating invalid things, like really reinforcing target behaviors, usually inadvertently, but it happens, like confusion about how do I validate, how do I be close to my kid, how do I keep them close? And that often, I think, in these parents is the ultimate goal, is they worry so much about the relationship and about what the kid thinks about them or what the kid is thinking about themselves, that they tend to bend to fit that rather than holding a course or rules or expectations. Parents tend to be too loose here, like we talked about from the DBTA model. They make light out of potentially non-normal adolescent or young adult behavior, rather than seeing like when it crosses the line into like, this isn't actually normal and maybe we need to take a stand here. These are the parents who might think nothing of a 16-year-old getting blackout drunk with their friends several nights a week on the weekends, and oh, that's just teenagers experimenting. It's like, well, sure, some teens are going to experiment with moderate substance use, but when you're starting to see a pattern where it's impacting school or where they're blacking out, right, that's where it crosses a line. So we're thinking again about these extremes, these poles. This is also where parents are fostering dependence, where they are continuing to do the kid's laundry rather than teaching the kid how to separate lights from darks, and kind of helping them to gradually increase independence in tasks of adulting. And a pattern of over accommodating, especially like anxious behavior or depressed behavior, but just when a child is struggling with big emotions, whatever they be, the parents kind of swoop in and try to make it okay. And on the other side here, we've got parents who are overly rigid and problem solving, the authoritarian folks. They are invalidating the valid. So these are folks who really need to do more work on validating and building that relationship and helping the child to be able to identify and understand and work with real emotions that are coming up for them, and for good reason. And they tend to be too strict and rigid. They tend to be overly critical. They tend to make too much of normal behavior, like, oh, my kid's on their phone for at least an hour at bedtime and they have a hard time turning it off to go to sleep. Like, that's it. They're losing the phone for the rest of the summer because I caught them on there one time 5 minutes late. It's like this overreaction to sort of normal things. And parents that are forcing independence, where they're expecting kids to completely go through the college process, application process completely on their own. They've got to figure it out. They got to get their SATs. I don't know why they didn't schedule their SATs. They got to do that. Like, it's not my job. They're the ones that need to go to college. And can be just dismissive of the kid's experience and overwhelmingly disapproving. And of course, we're looking for that middle path, right? That place in the middle where parents can be more authoritative and validate the valid but not the invalid, where they're coaching the child on how to identify and experience and respond to their emotions, and how to become how to have functional dependence where like with gradually they're gaining more and more independence, but that they still are dependent on the parent in developmentally appropriate ways. And this task, I think, really can often fall to us as therapists to help parents think about what is normal at different stages of development. And again, it can look really different in childhood, teenage, and young adult years. But there's a lot of confusion about that, especially in like late teens into late 20s these days about like what is an appropriate role of for a parent to be playing in terms of functionality for their child, how much to
Yeah.
talk to them
And
for
what's effective, right?
Mhm.
Given the family. Sorry, Megan, I didn't mean to cut you off.
And I was winding down, so
So one thing I just wanted to highlight is all these terms that we have here are all right. These are all from other intervention or I don't know if even other, but evidence-based parenting interventions, right? So we're not introducing really anything rocket scientisty new, right? But we're trying to unify this for us as DBT therapists and translate it into the DBT lingo. And so we're trying to find that kind of dialectic, holding the dialectic with both of these in the
yeah, I think I forgot to mention too is that something that we often will do with parents in that I've done it from a DBTA model standpoint, but is put this dialectical dilemma on the board or either virtually or physically and ask parents to think about where they fall on this spectrum and where their co-parent falls on the spectrum, and then also where the child or teen or young adult falls on the spectrum. So they can really start to identify how they act and how they work together. And a lot of times parents will realize that they themselves can jump from one to extreme to the other on different issues or even within the same issues, or that there's a good cop, bad cop kind of scenario at play. But I like it as an intervention, both to start teaching people about this dialectic, and then also to start to apply it to themselves as like, let me think about where I fall and if I can identify, oh, I'm more validating on this and my partner's more problem solving on that, and then to be able to begin to think about how do we be effective in finding a middle path and take the strengths that each of us have.
Yeah, and this is also a topic we could go in deeper about, like what are interventions to help parents come to the middle and to help parents almost even balance each other out or learn from each other's strengths. Again, so Megan's going to walk us through this kind of mutual reinforcement cycle that happens. And then we'll kind of start giving a bit more hands-on examples of our model.
Mhm. So this cycle that we're showing here is adapted from Ali Leibowitz's accommodation trap, and is also a good example of Patterson's coercion cycle. But you can think about this, and again, this is sometimes something I like to draw on a board and like help people think about this pattern that can come up in a lot of chains, like that there will be some sort of an incident of dysregulation, which I find, and maybe some of you can agree, that a lot of times to parents, it can be a little bit of a mystery. Like, I don't know what happened, but all of a sudden today, my kid won't get out of bed. I have no idea what happened. They won't tell me. They say nothing's wrong, but all of a sudden they won't get out of bed, or they're, like engaging again in a target behavior that they hadn't been seeing for a while. So often there's like some mystery around it. Other times it's clear, maybe there's a breakup or a bad grade or somebody got fired from a job or something. So there's some sort of incident of dysregulation. And then that can lead to a reaction from parents or family members of that where they're wavering or getting polarized and either being too accepting or validating or too problem solving and critical. And in either case, there's some sense from the parents of like a feeling of short-term relief, like, okay, we had a response, we got through the moment. And even from the kid, like there was a reaction and now they can kind of like get some space from it. But what happens when they're either on one side of the pole, the dialectic, or the other exclusively, is that we find that no real learning happens, that kids don't have the opportunity and parents don't have the opportunity to sit with the discomfort that the situation might be bringing up, to be able to really identify emotions and what those emotions are driving them to do functionally, hopefully, and to think about how to actually effectively problem solve. So instead, the dysregulated system is reinforced, and we go around and around again, where another incident comes up, there's an overly validating or problem-solving reaction, then there's this moment of pause or relief, short-term reaction of like, okay, phew, that's over with. And again, we find ourselves right back at the beginning.
Yeah. And now dysregulation can be a lot of different things, right? And I think as clinicians, sometimes it can be hard to know what to use when. So in terms of interventions that we know of, I've kind of tried to distill this short list of what are the core interventions we tend to do as parenting, as parent guides, right? So definitely any parenting intervention really has the foundation of acceptance work, validation, identifying dialectics, starting to think more flexibly and helping parents to be more flexible, providing psychoed to parents on what might be going on. A lot of, the more behavioral interventions involve contingency management. The other side of it is reducing accommodation, engaging the community, engaging support for parents and for the family, and of course, skills training. And kind of like I mentioned before, what we're focusing today is kind of how to structure and think about one-on-one sessions with parents. I would always suggest parents do skills training in some format. And if I have to do it individually with parents, then I will at least go over validation skills in the middle path module, partially because there's been at least a pilot study that shows that focusing on those modules has helped reduce target 1 behaviors in teenagers when working with parents. So within these interventions, right, there's a bunch of strategies. Again, we're kind of like bringing this home a bunch that like we all know a lot of these strategies. And what I'd like to do is walk you through a model that can help kind of unify all that. Right, so a lot of us know the Linehan's dialectical dilemmas. I am going to walk us through it because I imagine there are some who are not totally familiar. And so the dialectical dilemmas are called dilemmas because the individual with chronic emotion dysregulation has a hard time finding kind of the middle path or balancing the two, and kind of is going back and forth between the two extremes. And these are 6 patterns of behaviors we tend to see in individuals with chronic emotion dysregulation. We'll start at 1, which is emotion vulnerability and self-invalidation, right? So emotion vulnerability is when the individual feels very clearly and very hyper aware of the fact that emotions are so intense for them. And they're kind of feeling at the mercy of their emotions. You'll see the person express things like, I can't stand it. It's just the way my brain works. And often it comes out as well as a lot of rage. One hypothesis is that the rage is secondary to shame or fear that is going on underneath. And a lot of parents, I'm sure you've seen, whose kids are just extremely angry, and anytime they approach them, there's a lot of rage that gets thrown their way. And then on the other side of that, though, is self-invalidation, right? So there's a limit to how much a person can sit with this intensity of emotions and feel helpless. And they seem to inevitably then go to this place of beating up on themselves, and oversimplifying problems. So I'm such a piece of shit, and if only I could study every night, everything would be fine. As though it's easy to study every night. That's kind of oversimplifying the problem and not really thinking about the different issues, the different kind of the chain that comes into place and the different obstacles that come into solving the problem, which is why they're struggling in the first place. Then again, beating up on yourself, you can only stand for a while until you then kind of feel helpless and at the mercy of your emotions. And so you go back and forth. The dialectic of active passivity and apparent competence is, I think, the more kind of complex one to really understand. Active passivity, right, the way I usually describe it to parents or to people in general, is when a person is signaling that there's a problem very actively, however, is very passive about engaging in problem solving, whether it's asking for help or utilizing problem solving strategies themselves. Often There's a lot of helplessness that shows up, and sometimes very explicit, no, you fix it. You cause the problem, you fix it, especially with kids and their parents. Now, on the other extreme, though, so this is when the kid kind of really appears to not be able to handle things when maybe they could, it's unclear, or at least they could be taught to. But on the other hand, apparent competence is when the person seems like they have it until all of a sudden they don't, right? So what happens here is that there's a lack of skills generalization across contexts. So in certain contexts, like, I don't know, maybe at home, the kid is able to do math homework really easily, but then at school, when they're faced with a math test and the teacher's there and other students are there, they're paralyzed and they can't do their math. So there's something that's getting in the way of utilizing skills across contexts. The other way apparent competence can appear is when there's a discrepancy between what the person is feeling inside versus what they are expressing on the outside. And this is not the same as inhibited grieving that we'll talk about shortly, where there's emotional suppression. It's more that the person is either having a hard time or is anxious about expressing what is going on the inside. So they have a hard time articulating it, or they're afraid to express it. Now, what happens is that if a person is apparently competent, they are not really feeling the need to learn skills, right? Or other people are not thinking that they need to learn skills. And so inevitably they face a situation that they can't handle, and then they're back to active passivity. And so it kind of prevents a person from learning and generalizing skills. And then you go to active passivity. And if people are accommodating, or if you're really passive about it, you're also not learning skills, which then eventually lead to apparent competence in another context. Inhibited grieving is, again, basically, I kind of wish Marsha had called this inhibited emotions or something like that, because yes, often there's grief and loss, and sometimes there are things like anxiety and just avoidance of emotions in general and discomfort in general. And often what I describe to people is the person kind of is saying, I'm fine, they seem fine. However, you get a sense that something's up. And often it's a situation where other people would not be fine. So it's a little confusing as to why this person is fine. A lot of times our clients present in our sessions as basically, I just don't do sad, right? I'm good. I don't do anger. I don't do sad. I'm fine. Now, of course, if you're inhibiting your emotions and your grief, eventually something's got to give and there's going to be a crisis. And so you go back and forth between pushing down, and having a crisis. The other reason for crises is that a lot of our clients and individuals with chronic emotion dysregulation have a lot of co-occurring issues as well, like executive functioning, other disorders, other physical illnesses that also make it really hard to cope. And so they too find themselves going between pushing everything down and having a crisis. Now, so this is where the kind of overly problem solving and validating parent might come into play in terms of inadvertently reinforcing these behaviors. The overly validating parent with a kid who's expressing emotion, or a child expressing emotion vulnerability, might really overfragilize their child, right? And do a lot for their child, or over apologize. I've had a lot of parents over apologize when their child is angry at them or helpless. The more problem solving parent might just dismiss it altogether and say, oh, come on, just stop it. Like, there's no way you could be feeling this that intensely. With self-invalidation, I find that parents who are very validating and kind of indiscriminately validating tend to provide a lot of reassurance, because they don't want their child, obviously, to feel this way about themselves. And their way of helping their child is to reassure them that they are okay, that they're not that bad. And often parents who are more problem solving, in my experience, either tend to kind of they tend to kind of provide blanket statements, right? Like, you're amazing, you're beautiful, you're wonderful. And of course, that's coming from a place where you don't want your kid to be suffering so much. And it kind of misses the mark. It can feel very invalidating for the child. They also, tend to oversimplify as well, kind of collude with the oversimplification of, all you got to do is study harder and then everything will be fine, which of course then reinforces the child's tendency to oversimplify. With active passivity, parents tend to, kind of like the mom that we're working with today, kind of problem solve for their child, accommodate, and maybe even nag. And the more problem solving approach would be, often when parents are burnt out, is to be like, you know what, you're on your own. You can do this. I don't know what's going on, but I'm not dealing with this right now. And with the parent competence, everyone's kind of confused. Like it's hard to understand how your kid can do so well in one situation and not the other. I find that the overly kind of validating parents tend to kind of just back away. And just kind of like express confusion, but kind of accommodate and not really ask too many questions. Whereas those problem solving parents, or in state of problem solving, tend to assume manipulation much more. With inhibited grieving, often it's very tempting for parents to kind of buy into the quiet. Like finally they get a moment of peace and quiet, and it's very hard to lean in and look at the emotions that might be very difficult that are going on. And so they kind of retreat, maybe in different ways, depending on their parenting style. And then when a crisis hits, right, there's either kind of invalidating, like, why are you doing this? What's wrong? Not again. Like, what's going on? Enough already. Or I've actually had problem solving oriented parents kind of swing into a ton of compassion when a crisis hits.
Then
So
teach the kid the only way to get compassion from my problem solving parent is to be in a complete meltdown.
yeah. Oh. So sorry. So what we're gonna
Yes,
sorry about that. So what we'd like to show is another snippet from our session, where the clinician is starting to kind of formulate this kind of conceptualization, trying to understand, like, what are the different dialectical dilemmas that might be at play here, how the parent might be reinforcing the kind of dysregulation, and kind of starting to kind of build some ideas.
So, yeah, so one thing I'm hearing, there's these two terms that we can kind of talk about called active passivity and apparent competence. They sound kind of fancy terms. But active passivity is like when someone is being very active about signaling there's a problem, but not solving it themselves, and maybe even kind of demanding other people solve it. And at the same time, and it feels like we can't do it themselves. And at the same time, there's certain things they're able to do so well that it can be kind of confusing. Like, how can you write an email, right? Yeah, it's so coherent, but then like you can't press send, and and you can order all this takeout and be active with that, but then you can't get out of bed. Like, it's confusing.
Yeah, and I don't know why she can't do that, but I think that's just ADHD. Like, it's not her fault. She has ADHD. That's just like when I watched the TikTok stuff.
There's probably things that make it harder for her, right? And then you get pulled in to try to do it for her, kind of, because you don't want her to get stuck. So you kind of try to get her unstuck,
right,
by doing things for her.
Yeah, I do try to nudge.
I imagine you also get frustrated when you see such a coherent email and all this takeout, but then no active movement on the stuff you want her to move on.
Yeah, well, Jim gets really frustrated with that, and that's the whole other thing. Is like he's just so frustrated and he's so unhappy. Like, this is just like not the life he wanted to have, or the kids that he imagined us having. And like, I'm sure she can tell how frustrated he is with her, and like, I just feel like there's no point to him being so frustrated. It's not her fault that this is happening, and like, she needs our help.
And it's not uncommon for parents to kind of see the two sides of the kind of polarity. And I can understand that when you're confused about these behaviors, these discrepancies, that you would get frustrated. Right. So a lot of times people act in a way that's passive, even though they're very actively telling you there's a problem. Either because they're scared to ask for help, or they don't know how to solve the problem because they're overwhelmed, or they're anxious about admitting they need help.
Yeah. Maybe she's feeling like that.
And sometimes they themselves are confused. Like, my guess is that when she knows she doesn't have to actually show the email to anyone other than you, she's not as anxious about writing it. So you can write something coherent. But it sounds like there's some anxiety or some overwhelm gets in the way when she's being judged by others.
Yeah.
Right. That makes it harder for her to be effective in the context of school.
Yeah, I guess I didn't think about that because she doesn't like act anxious. Like she doesn't seem nervous. She just doesn't do anything. Like I don't know. I never really thought of her as being anxious.
Yeah, and sometimes with apparent competence, another side of it is that there's kind of like a mismatch between what the person feels inside and what they're expressing. Like inside they might, and it's not because they're pushing down, they just don't know how to communicate what they're feeling inside, maybe even themselves. So she might be feeling, we don't know, but she might be feeling like a lot of stuff inside, but what you see outside is this chill, I don't want to kind of approach. And you assume, well, how bad could it be if that's what she looks like?
Yeah.
And then you get probably even more frustrated and confused.
Yeah.
It also sounds like she has a hard time. Like, my guess is like she's so excited at the beginning of these plans.
Yep.
That something's gonna work, that she doesn't really want to think about what things might go wrong, because that makes it scary and you need to slow down. And so she pushes all that away and she's excited until shit hits the fan. And then all of a sudden it's a crisis and she's paralyzed.
Yes. That's true. Yes.
And it probably goes back and forth, maybe not all the time, but eventually something's got to give if you're not facing the reality. And then there's like a crisis and you feel like you're constantly going back and forth between excited Jessie and crisis Jessie.
Yeah. That is kind of what happens, although it just doesn't last long. And then
right,
flops.
Yeah.
Megan, do you want to keep going?
Yeah. So as you could see in that clip, what from when we're working from this model of parenting intervention, this little image here shows really like kind of the formula of what we're looking for. And we really think it could be it is to us, and we hope it can be to you, a really helpful way of organizing yourself and like anchoring yourself as the therapist in the situation, to be thinking about what you're going to focus on. So looking for pulls of the dialectical dilemmas in an interaction between the parents and the child, and to really be thoughtful about what could be driving this polarization that's occurring, and both from like the emotions and reactions of the parent, but also what the kid might be experiencing. As you could see, Livia was really coaching Tara on thinking through some of the unstated, indirectly communicated emotions that Jessie might have been experiencing. And some of that was really surprising, I think, for Tara, and often is for other parents that we've worked with too. They're really just paying attention to what they're seeing, and they're not able to see beyond that to imagine what else might be going on that might be driving the kiddo's behavior. And then being able to identify in a non-blaming way what might be happening that's reinforcing parental behaviors of problem solving or overly validating, and just again like identifying that pattern is occurring, and then giving options for intervention, so how they could approach it differently and ways that they could strategize to have a different outcome. And I find that really that last step of the process becomes much easier when the parents are on board with you and have been able to understand and identify the polarization that's occurred and the function of these behaviors that they're seeing, that there's a lot more buy-in that way from the parents on then agreeing to try a different strategy. And as we saw in the video clip too, there's a lot of times where the dialectical dilemmas can overlap, where you might see more than one happening at a time, but that by paying attention to the dialectical dilemmas, the therapist can identify subtle themes in each pole that can help orient the therapist toward a roadmap of what strategies might be helpful to try to use for intervention in that scenario. It's really meant to be a guide and a way to orient and anchor yourself as a therapist.
So we're going to go through each of these. Sorry, Megan, I'll let you go.
Yeah, so the next few slides are, we go again, building off of what Livia shared in the slide with the dialectical dilemmas highlighted. We'll look again briefly at what each one of the poles is, and then in the blue squares and below that, we'll talk about which interventions we suggest trying for that dilemma. And so these are really great cheat sheets that a therapist could use, again, as a roadmap for what to try. Okay, so here's our chillin', apparently competent kiddo who really thinks that they're acting like they've got it all figured out, although this is often really inconsistent, where how they're acting or what they're saying really might not match up with what's actually happening functionally in the situation. So the person might seem really confident, be acting like they've got this, but then they fall apart later. So they say that they're sad, but they look fine. There's just the clues here of what you might notice is that there's just a big mismatch between what they're saying is happening or what they're showing and what they're actually feeling. So some of the drivers, like why might this be coming up? Because the person has learned that expressing negative affect is bad. So they're likely really sensitive to shame and feeling like it's not okay to be vulnerable or to not know. And it's much better to seem like they got it. And this is definitely the case with Jessie, where Jessie prefers to measure up to the parents and be sort of like a third adult in the relationship. Like we're all roomies and like, I actually know how to do all this stuff, mom and dad. I don't know why you're telling me what to do. Like, what do you think I'm dumb? Of course, I've thought of that. But then they're saying all these things, but then on the other hand, they're really not functioning. So their functionality is not matching up with the bravado or like competence that they're saying that they have. On the other hand, they may actually have competence in some areas. So it can be confusing both for the kid themselves and for the parents. Like, I don't get it. They do so well when it comes to like operating with this friend, or like, wow, they really held it together and did a great job in this nannying job for all this time, until all of a sudden things sort of unraveled and fell apart when they met with this one particular obstacle.
So, I mean, I listed kind of like some of the core, I went through this already a little, some of the core kind of reactions sometimes parents have that might inadvertently reinforce these patterns. And then underneath, I put kind of like the emphasis, right? So, on what you might focus on and hone in on the kind of buying into the rose-colored story for the over-validating parents, validating kind of the elephant in the room. So like, right, you know, validating the invalid essentially. And the over problem solving parent, there's more of an emphasis on maybe helping the parent hold the dialectic, and understand that there's a skill deficit and there's some competence. And so the theme essentially that you'll focus on is one is really providing psychoed, because I think often parents and the therapists, like we're all just very confused, and reminding ourselves, wait a second, there might be some apparent competence here, and then discussing with parents and describing to them why that's there, what is skills generalization, why would it show up in some contexts and not others, can be super helpful. We want to also be vigilant ourselves and help the parents be vigilant when they see a parent, when see competence showing up, and then seeing kind of the opposite happening, so that even when there's competence, like help your kid cope ahead yourself. Don't assume that they can do well in any context just because they can in this one. And then a phenomenon I often see with parents is this kind of what I termed willful bewilderness, is that I tend to see that even after I provided the psychoed again and again and again, parents continue to kind of like, I don't get it. What the hell? Like, I don't understand. And so kind of playing a lot of broken record, helping them identify, like, is there something that's getting in the way of you accepting that your kid might be competent in some areas and not others, or that they're having a hard time expressing what's going on the inside?
I'm going to try to challenge myself as we go through these slides to spend a little bit less time on what is the pull, because we did spend a lot of time on that before, so that we can really give Livia enough time to talk through what we suggest for interventions. So here again with active passivity, that's again like, you know, the turtle lying on its back, legs in the air, like, I don't know what to do, help me, I'm stuck. Right, but so, and that the parents can often have an urge to go in and help, even if the kid hasn't asked. They may just be showing that they're in trouble, and the parent is vigilant and paying attention and wants to swoop in and do something. Or on the other hand, another clue for a parent or for you watching this play out could be that the parent has a lot of resentment or repulsion at the idea of having to help, like, oh God, you know, like, not again, like I shouldn't have to do this, a lot of should statements coming up. And the drivers again being about anxiety on the part of the kiddo about asking for help or not knowing how to ask for help, and probably shame about that as well, and shame about needing to ask for help or not knowing how to solve the problem. And that the person may have learned that the only legitimate way to get help is being in a crisis, as we talked about earlier. And that there can be a lot of hopelessness too, learned hopelessness about, like, this has just happened so often. Why would I expect a different outcome? I don't know how to deal with what's going on. So I'm just gonna like throw my hands up.
Yeah. Right. And so again, we can kind of imagine what the overly validating versus problem solving parent might do, and how that might kind of help us kind of think through how to approach it maybe differently depending on the parenting style. What I've found in terms of themes here is that one, kind of helping parents kind of what I call sidestepping the content. So for example, right, I recently had parents whose kid, whenever they were on the phone with him, was shaking his pill bottles. And we've done extensive assessment of risk and all that, and safety planning. And so we felt pretty confident that there's something else other than I want to, you know, suicidal thinking that the child was trying to communicate. And so we focused on helping the parent kind of almost actively ignore that pill bottle shaking and dive deep into, like, sounds like you're really struggling right now. Do you want us to tell us what's going on? So they're not naming the pill bottle shaking, and they are naming what might be kind of the accurate expression, essentially. And that's kind of like, you know, we talk about therapists trying to drag out new behaviors from patients, and I think we can also encourage parents to work on that. Like, how can you drag out these new behaviors from your kid? How can you drag out, give them permission, help them learn to ask for help them express themselves more accurately? And refraining from chasing them, right? So parents often, we can kind of like help them identify this visceral experience of, I'm chasing my kid because I'm so scared because they're so helpless. And can we help them kind of almost engage in their own exposure work to pause and slow down instead of doing that?
Okay, so then the next one is inhibited grieving, where we have again the kiddo or parent who is really suppressing some, usually a negative emotional experience. So they seem okay, they're acting okay, even though really the situation does not call for being okay. So there's this feeling that's like kind of weird, like they seem fine, but they shouldn't be. And usually the driver here again is avoidance. They don't know how to tolerate that distress or discomfort, and so they're like, stay away. I'm not doing this.
Right. So I'm going to go straight to the themes. I think that's the core here, right? Is one, really helping. This is where the validation skills, I think, are extreme. I mean, they show up obviously everywhere. And here, like, helping parents validate, especially levels 3, 4, and 5, of kind of like mind reading a little bit and normalizing that this situation, and it would be normal that the child feels XYZ, to encourage accurate expression. I talk to parents about kind of practicing rocking the boat. So again, parents, if there's unrelenting crisis, they're very tempted to let the inhibited grieving just go with the inhibited grieving, because there's some quiet. And it can be very scary for parents to start approaching their child in discomfort when they're finally having some peace and quiet. And so this is something, again, it could be even an exposure for parents, especially parents who are themselves not very open to their own emotions. And so helping parents start identifying their own kind of primary emotions and modeling some openness and vulnerability with their child, so that their child can learn over time that that's okay.
Okay. And then in unrelenting crises, we're on fire. And a lot of times the clue that this might be going on is that the person is tired. They're sick of all the fires. They're sick of all the crises, and they're tired. They're exhausted. They might be angry or frustrated. Or that they're like on edge, expecting that other shoe to drop, or waiting for the next crisis to hit. And usually this comes up when avoidance has caught up with the person, and that they've learned, or that the person has learned, that the only way to get help is to be in crisis. And that the person just may struggle more inherently with impulsivity, or not be skilled up in being able to identify and cope with problems effectively. And they may have overlapping psych conditions that just complicate crises or stressful events when they come up.
Right. So some themes here, right, that I think we're all very familiar with. The first one is like, responding as needed to a crisis without kind of reacting. So kind of being neutral, matter of fact, so you're not inadvertently reinforcing what's going on. Being very mindful of the child's capabilities and lack of skill. So where does the child need help problem solving to get out of this crisis or this hole that they're in? And when do we need to validate the valid that they're just not able to, and they need help? Really helping parents take care of themselves when in crisis. And I think the more important thing here too is, or maybe not more important, but also a very important thing, is helping. So often parents, I've had parents like, what's wrong with validating them when they're in the hospital? They're struggling. There's not really anything wrong with validating when they're in the hospital. The problem is you didn't validate before, right? So how can we chain things to see where you could have started with paying attention to their emotions without this, explosion of emotion and crisis taking over, so that it's not just when they're in crisis that you're validating, or mostly, and they're not therefore being reinforced to be in crisis.
In emotional vulnerability, the person is really at the mercy of their feelings. There's the clues are a lot of helplessness about, I can't help it. This is just how I am. Like in the case of Jessie, like, what do you want me to do? I have ADHD. Like, I can't clean my room before the cleaners come. Like, that's just impossible. I don't know how to do it. It's too hard. It'll take too long. Or rage at others. This doesn't come up as much with the case here, but I've seen this with other folks where they get angry and do a lot of externalizing, like, it's your fault that I'm like this. I never asked to be born. This isn't my fault. And functions are a little bit different. We move away a little bit from, there can be anger shows up as secondary to shame, usually about feeling out of control, and fear and helplessness in the face of being really overwhelmed with the big emotions that they're experiencing or the challenge they're facing.
Right. So helping parents validate the primary emotion, like shame or fear that's underlying. And then kind of this taking a dialectical approach where they're observing their own limits. So they're not kind of over apologizing and, even like harping on the kid when the kid is very overwhelmed, but kind of being able to back off and come back into the interaction as needed.
Okay. And then the last one here is self-invalidation. Here we have the people who, when they are oversimplifying problems, or just having unrealistically high expectations about themselves. And you can also see some shame about their emotional sensitivity or self-hate come up in this poll. And there's sort of an insistence on I'll just be fine, or I'll just get over it, or if I just do this perfectly, there's really no need to go through the muck and mire of feeling these feelings, or I suck, I'm crazy, like what's wrong with me? Nobody else is like this. Why is it so hard for me? So again, we see here that there's a lot of oversimplification of the problem at hand, and not a real difficulty with self-validation, not being able to see the dialectic that I have some control over this, and it's not all my fault. Like this is a problem and I need to solve it, even if I didn't cause it.
Well, yeah, and part of it I might need help with, and part of it I can do, right? And so a theme that comes up here, right, is like, again, helping parents be mindful of whether they are also oversimplifying the problem, helping parents start scaffolding with the child, shaping, modeling, encouraging small steps, and validating the emotion. So, oh my God, I suck. So parents often are saying, you know, what should I agree with her that she sucks? Well, no, but you can validate that she must feel really crummy if that's how she thinks, right? So kind of going under, again, the content and validating the emotion underneath. Now we're going to end with a short clip that speaks a bit more to those of you who kind of wanted us to validate the parent a bit more, where we orient the parent to kind of figuring out how she can focus on her own behaviors rather than trying to control the child's. And when we do a more comprehensive training, we can go through these different dialectics. The main message here is that we're dialectical in DBT, right? And so we don't have to wed ourselves to one extreme here or another. We can help the parent change the child's behavior through changing their own behavior. And that's kind of a new way of thinking about it for parents sometimes.
The thing about these cycles, they keep going around unless we intervene and start responding differently. Right. My guess is she was
differently. I mean, like, you don't think what I'm doing is good enough?
Well, I don't think it's a matter of good enough. Like, you're clearly really love your kid and really want to help her. Like, it's clear that you're devoted to her and you empathize tremendously with her.
Yeah, that's
right.
true.
And when you see her suffering, it's really hard because you feel for her. Like you just said, she's depressed, she can't. And it can feel pretty helpless as a parent to see your kid suffering and feel like you don't have that much control. And you just want to make it better.
I don't feel like I have any control. Anything I try to do doesn't help.
And so I actually think you're probably doing a lot. It's more the how that maybe we could tweak. Like, you're pressing the gas a ton, but the wheels are spinning. And we need to figure out how to help you press the gas so that the car starts moving.
Yeah. Yeah.
Right? I grew up in a place with no snow. And when my car gets stuck in the snow, I don't know what the hell I'm doing. I'm just pressing gas and manically trying to get the car to move. When my husband grew up in Ohio, where it snows over time, all the time. And he knows how to move the car so that it gets out in like 2 seconds.
Yeah.
So it's more of a question of like, how can we respond in a way that doesn't increase these patterns?
Mm-hmm.
Not how much we're working, because most parents work really hard to try to get their kids on stuff. It's not how much they're doing, it's how they're doing it, what they're doing.
Okay. So what should I do different?
Well, so let's talk about that, right? So one thing I'm noticing is when she gets kind of too anxious to act, she kind of, there's this expectation, you expect it of yourself, she expects it of you to solve the problem. Right?
Yeah.
You're finding yourself feeling like you need to text the school or to email the school because she can't do it.
No, she just doesn't. She just wouldn't do anything.
Yeah. And so it might be too much of a jump to say, hey, you got to do this.
Mm-hmm.
Okay. I wonder if in a compassionate way, if we can work on working on doing it with her. Like even sitting on the bed with her, telling her how proud you are of this really nice email she wrote.
Yeah.
And her even just pressing send, for example. I feel like we need to kind of do a bit more digging to understand if that would be the effective thing, because I want to know more about like the situation at school and how behind she is and how necessary it is for her to drop out. I feel like I need to get to know, but that's like an example, right? Of instead kind of getting used to instead of doing for her,
Yeah.
to start doing with her, so that you're teaching her the skills so that she eventually can do it for herself.
Yeah.
It's a process. It's gonna take time. Like I'm kind of throwing a lot at you, right? But really, what I'm asking, like, can we focus not on changing her, but on shifting how you respond? Is that something you'd be open to?
I think so. Yeah. I don't know what, but yeah, if we can think of
Well,
something.
if you knew what, you wouldn't be here. Pretty sure.
Yeah. Okay.
Yeah. The thing about these
Sorry.
cycles.
All right. Okay, so I feel like there's a lot more left to say, and I know we're short on time. I appreciate you all staying here. I'm happy to stay on if there's more questions or any discussion points. The core concept here is that we're not prescribing kind of different interventions. We're using interventions that we know work, that are tried and true. And we're proposing helping clinicians kind of shift what they're paying attention to, what they're prioritizing, and for this to help get organized in our work in parent guidance and DBT. So again, happy to stay on if people have more questions. Apologies for going over a couple minutes. Just as a reminder, right, if you want to contribute to Family Connections, please put the link in the chat again. I will be sending out forms to complete for CEs as well. And one of the things we'll include is a feedback form. Even if you're not looking for CEs, we'd love to do a follow-up training that's a bit more in depth. And so if there's any like lingering questions, things you would like more focus on, or that were helpful or unhelpful, would be great to hear. Okay. When would the longest training be? Probably sometime in May. We're not sure yet.
Thanks everyone for your participation too. It made it fun.
Yeah, I'll be sharing the slides as well. I apologize for not having those. I feel like I'm over apologizing today. I can't stop apologizing, but I will send out the slides so that people can have them. Okay. All right. Well, also feel free to email either of us, and we will be in touch with more information on future trainings. Take care. Thanks for coming.